Hi, I'm Maggie Welch, and for American Sentinel University, today I'm talking about service learning. The International Council of Nurses position statement that I believe to be relevant to the simulation Sentinel town is health of migrants, refugees, and displaced persons. It was evident in speaking to the townspeople, namely the doctor at the clinic, Elliot Evans, and Dulce Lopez, who is a registered nurse, that there is a large immigrant population in Sentinel town. Both Dr. Evans and Dulce expressed concerns of a language barrier for those immigrant citizens and also a lack of healthcare knowledge about things like immunizations and insurance. If I was part of this town, the service learning project I would perform would be a monthly event at the clinic geared towards immigrant or Spanish-speaking citizens of the community. To advertise this and spread the word, I would make flyers in both English and Spanish and distribute and post them throughout the town. The monthly event could be a class to learn about immunizations that are available to adults and children and why they are needed. Another could be about basic information about health insurance and how to obtain it, and also about obtaining low-cost health care if they cannot obtain insurance. Another event would be for screenings such as blood pressures or skin cancer, and education about these health issues and why regular checkups with a healthcare provider are important in preventing further health problems. As nurses, health promotion is a large part of our practice. This is shown in many different International Council of Nurses position statements. One specific example of where this is reflected is the position statement on antimicrobial resistance, which calls on nurses to educate patients and families about how to prevent infections in their homes and communities, and provides patients and families with evidence-based, accurate, and non-judgmental information on the benefits and importance of immunization for health outcomes. The World Health Organization defines health promotion as the process of enabling people to increase control over the determinants of health and thereby improving their health. Nurses have the knowledge and expertise to educate patients about general health or disease-oriented topics, and we have the trust of our patients and their families so that we may empower them to become engaged in their own care. So that's where the nurse's role in health promotion lies. When I was in nursing school for my associate's degree, we had to do a small group service project where we set up at a library for a few hours. We took people's blood pressures and had some basic information on blood pressure readings and what they mean, and we also had some healthy eating tips. Although it was a very small project, with everyone we talked to, it was easy to see the impact that our information had. People feel involved in their own care and well-being if they know that someone they trust is encouraging these things, and it doesn't seem as daunting a task to change their habits or lifestyles if they have the proper knowledge of how and why to do it. Every day as nurses, we have the opportunity to educate, and sometimes we forget the impact we can make. Thank you.